Good afternoon. I am Morgan Vaughan. This is Facts at 5. This is LTV. It is Wednesday, April 15th, 2020, and I am here again with ACE reporter Chrissy Sampson from the East Hampton Star.
Hello.
Thank you, Chrissy, for being here.
Thank you for having me.
Okay, the lead today. Everyone must wear a mask. What happened?
So Governor Andrew Cuomo this morning in his address announced that starting 3 days from now, so Saturday, people are going to be required to wear masks in public when social distancing is not possible. So for instance, if you're in public transportation and you're near somebody or at the post office or on a street where there's a lot of people coming at you, wear a mask. It's going to be a requirement now. So the governor was saying that, it's for public health. It's for the public safety. And already tonight, he's got the order going into effect for essential businesses.
Okay.
Essential workers.
Right. Tonight is when it's the essential workers. People who are dealing with the public have to wear a mask.
Starting at 8 o'clock tonight. So in just a few hours, we will have to start that. And businesses are supposed to provide those masks at their own cost.
Okay.
So, but now people, I guess, are going to have to source their own masks as well, but not surgical masks. The governor made this distinction that we still have to save those surgical masks, the N95, for the healthcare professionals and law enforcement and first responders who are dealing with the general public, the wider public.
Right.
And that we should still wear face coverings that are slightly different that maybe we make ourselves. You know, LTV has the mask making video now,
Right.
as well as lots of other resources out there.
And you can also just have it. There's T-shirts that you can just wear a scarf, a bandana, but your face has to be covered, including your nose.
Your nose and your mouth. And that
Okay.
those guidelines are on the CDC website.
I feel like we have been talking about masks on and off, this and that for weeks, and this just seems like it's the final push, because what else can they do?
What else can they do? This is the final thing that I think that they can take, but because the guidance has been changing literally every single day.
Right. And really, we were talking about this before the show, that it's really, if you think you need a mask, you probably need a mask. I mean, it's a little bit of common sense, too. Okay, so what about what's going on with the statistics today?
So today, the county announced that the total positive cases is 23,480 confirmed patients.
Wow.
And again, that is the same consistent. It's about a 44% positive rate.
Okay.
We are up about 820 cases over yesterday. Now, that's a little bit more of an increase in the last 24 hours than we'd seen in the last couple of days leading up to this.
Okay.
But it's still, the governor and the county executive, Steve Vaughan, still are saying that we are likely headed for a plateau, that the social distancing and things that we've been doing are working.
Right.
We still have to do them.
Right.
And the masks now, of course. But one of the things that I wanted to talk about is density, because if you look at the scope of cases across Long Island, East Hampton has 106 cases, but Up Island, you can definitely see.
Oh, can we have the map, Jason? Perfect. Thank you.
Thank you. There are over 6,000 cases in Islip, 4,300 in Brookhaven, and the density in those areas is a lot higher than it is out here.
Right.
We're a little bit more spread out. I just wanted to put this in context for our viewers so that you have this visual you might not have had already. We are dense here among ourselves to a lesser degree than like Brentwood and Huntington and Brookhaven, some of those communities.
Well, I was saying before also that I was watching the national news this morning, and I saw Steve Vaughan and Suffolk County on the national news, and I shared with you that my in-laws are in Texas, and they're calling my husband freaking out because Suffolk County is so hard hit, and so we are. But this gives a really good perspective about how out here we're not quite as dense as maybe Up Island, Suffolk County.
Right. And of course, we talked about this yesterday a tiny little bit, that these numbers might not even paint an accurate picture.
Right.
Because these are only the people who have been tested. There are many more folks who have not been tested. The governor made this point this morning.
Yeah. I mean, that's what's going to be so interesting is when they finally get this antibody test and we're all tested, what the real numbers are going to be. I think that's going to be very illuminating. Okay, let's talk stimulus package. Sorry.
I didn't get mine.
Oh, well, I got mine. So here's the facts about what happened with us. We haven't filed yet for 2019. We're just in the midst of it because there was a delay. So I think we should be done by next week. But we didn't file for 2019 yet. We did obviously file in 2018. We had direct deposit. And today we got money for 2 people. So, and it was $2,400. No taxes were taken out yet because I heard some speculation about what was going to happen with that. So eventually the taxes will be taken out, but that's what was put in our bank account this morning with direct deposit and having filed in 2018.
So, as I understand it, we will be paying taxes on it the following year.
Yeah, great.
So, and so I understand that you have a dependent.
We had a dependent in 2018, but he has since declared, he's older and he's declared independence, and that's probably why he wasn't included, because I was wondering about that. I was wondering if we were going to get, because there's $500 per dependent, but we didn't get that. And that's fine. It can, go to him. But I thought that was interesting because I thought it was based off of your 2018 taxes. So they must be figuring out what's going on.
Yeah, I mean, there are a lot of people waiting. I know I went to the post office today looking for it. Did not see it, unfortunately.
Right. I think the direct deposit is key.
Yeah.
And that's what we've just done for years. Is just had that. Usually we're paid, but we had that. So anyway, that's the facts on that. So I'm one case.
I've heard a few other people getting it. I just, come on, guys, where's mine?
Right. I know. Sorry. Okay, next. Oh, okay. Suffolk County marinas.
So we got this information on our phones this morning because we have signed up for the COVID-19 news text alerts. Suffolk County marinas have been delayed in their opening until at least May 1st. No boats in the water before May 1st. And as well as golf courses have been declared non-essential.
Right.
I mean, it was the last game standing for a while.
Right.
But now golf courses are closed. Tee times are supposedly canceled without any penalties. And then park areas that are still open, but those that do not provide social distancing opportunities are closed. For example, restrooms, campgrounds, playgrounds, dog parks.
Okay.
So, and camping reservations are also canceled. It's just a matter of safety still.
Right. And so, but May 1st, we hope, but again, that could very well change.
That could very well change because that's only a couple of days after the governor's most recent extension of the pause order was through April 29th. And we're probably going to see any day now that be extended, most likely. That would be my guess.
Right.
But it's taking a wait-and-see approach. The governor has been making those announcements every 2 weeks.
Okay, so we've been talking a lot about the food pantries, and there was an article in the Independent about what's been happening at the East Hampton Food Pantry. And one of the quotes that I thought was really interesting was that Vicki Littman says that last year in March they served 1,200 people, this year 1,800 people, so 600 more people in March. The food pantry operates from 1 to 6 p.m. every other Tuesday. And that's also a change that just happened. It was every Tuesday, now it's every other Tuesday. And on those other days, Springs and Montauk pick up. But they are, of course, looking for donations. So if you can donate to the food pantry, please send a check. I'll have the address at the end. And if you need help, then you should call the food pantry and see if you can get on the list to be helped that way. We also got a note that the Springs pantry, because of the extra people, are looking for commercial freezer space. And I actually put this on the crawl a couple days ago, so I don't know if this has been fulfilled, but if it hasn't, you should contact Drew Raleigh at 631-907-0177 to see if they can have any extra space to fill for all of the food that they need. Okay, so we were going to do the subject of the day today. We were talking about coping. How have you been coping?
I have been doing online dance classes.
Oh, yeah?
Lots of great options. I took a dance class with one particular teacher who then thanked me by sending me a roll of toilet paper in the mail.
Oh, nice.
Not kidding. That happened.
Oh, my gosh, that's funny.
But I've been watching a lot of comedy specials, and talking to my friends. How have you been coping, Morgan?
I think pretty much the same way. I don't feel like I'm getting the kind of exercise that I used to get. I don't, feel like I'm getting out as much as I used to. But I did find this amazing emotional survival guide for COVID-19 that I put on the LTV Facebook page as pictures. And one of the things I thought was so great about it was that the behavior scientist who did it puts things in two columns. One is for during periods of lower emotions, in other words, no one's having a meltdown, to during periods of higher emotions, in other words, meltdowns are imminent. And the higher emotion ones have more to do with doing intense exercise, changing your body temperature, all of this. I thought this was interesting. To dip your whole face in cold water for 10 seconds, take a breath, and then re-dip again. Clearly, you're following this already because you're getting exercise, which I think is one of the most important things. I thought this was another great one. Oh, well, there's a lot of the relaxation techniques that we know, tense and release your muscles, et cetera. Plan something amazing for when this is all over, which I thought was a really great one because it reminds you this is going to not be forever. And I thought that was really good. This place also has an amazing list of websites to visit that have, museums, et cetera. I thought this was really great, so I put that up there for people. Because this is really tough. We are going through an amazingly difficult time, I think.
Absolutely, I would agree with that. And, do you have any information on one of the difficult things that we've been hearing about is hospital capacity?
Oh, well, so far what I hear is that things, and we actually, Angela LaGreca has an interview with Barbara Jo Howard from the Stony Brook Southampton Hospital, but apparently they're saying that they have managed to keep its care capacity, staffing, and equipment supply comfortably ahead of the influx of patients. So that's really good news. I've also heard this anecdotally from a doctor friend of mine who said the same thing, that we're managing to keep ahead. So that's good news, and that should be able to alleviate some worry.
Absolutely. Thank you for that.
I had one good news headline that I had was I saw this fun activity. Make a quarantine playlist with the Amagansett Library to help create the Amagansett Library quarantine soundtrack. So you have to be between ages 13 and 19, and at least one song from each playlist will be included in the quarantine soundtrack. And you email Evan Harris at amagansettlibrary.org. Anything else that you have?
I would just like to say that everybody around me is basically staying really positive and using humor as a coping strategy.
Yeah.
And I'm really grateful for that.
Yeah, I think that is really, really important. I had an update on the what I was talking about with parenting yesterday from some of my friends, and it is a very, very stressful time for parents, I think. And so, like you just said, keeping the humor in it, I think, is above all. And the idea about watching funny movies and trying to keep your spirits up. But it is. I'd like to talk more about parenting in the future also because right now it's all about you have to be a parent and an IT professional all of a sudden too, which I thought was a really interesting point someone made. But right now I'm going to switch to a note on recent deaths. So all of us are beginning to hear and know people who have passed away. And our community has lost several pillars of our community in the past few weeks. And unfortunately, we will undoubtedly lose more. So what we've decided to do at LTV and Hamptons Five is we are not going to update deaths and do an obituary for prominent people because that changes and that really depends on who you are. Everyone's definition of prominent is personal. It's a slippery slope to start mentioning anyone who's passed. So what we will do is that our staff is keeping track, obviously, of what's going on. And if a person represented in a number of videos at LTV in the archive passes, we will generally replay those videos. Later on, we put a slate in front of it to let people know. And we mean no disrespect at all by making this decision. We have lost friends too. And that's why we've decided on this tack, because we want it to be a very
It's hard to put into words.
Yeah, we want it to be real, and we want it to be not just something that I just say. So anyway, that is what we're going to do here about that. And we hope that lots and lots of people remain healthy and stay safe and stay home.
Thank you, Morgan and Chrissy. Today, we are very excited to have an update from Stony Brook Southampton Hospital. Joining us at FactSet as our special guest, Barbara Jo Howard, who is the Director of Communications and Marketing at Stony Brook Southampton Hospital. Barbara Jo, thank you for taking the time to be here with us today. We really appreciate it.
Thank you for having us.
Well, I know this has been quite a month. How's everybody holding up there at Stony Brook Southampton Hospital? I know it's been a very trying time for everyone. And how's it going?
I'm inspired every single day that I come to work with incredibly awesome people who are brave and committed and dedicated and doing amazing things. And I'm just inspired every single day.
So we've seen the numbers. We know there are over 21,000 COVID patients in Suffolk County alone. How has the hospital mobilized for this pandemic? I mean, there's a lot that's changed there, I know. What would be the most dramatic change?
Well, definitely the bed count has been increased 100% from 94, which we're actively staffing, to 184, and actually have room for a little bit more. And we've also increased our ICU threefold from 7 to 21 beds. And we've recruited over 50 nurses and as well as 10 respiratory therapists as well to come in and to help us with regards to staffing. So,
how are you able to do that physically to increase capacity like that? How did you actually do that? And was it in adjunct buildings or was it inside the hospital?
It's all inside the hospital. So, for example, we have our cardio rehab area that it was filled with equipment. We completely moved that out and brought in beds and every single thing we needed in order to make that into a non-COVID area. And then in a lot of the other areas, such as where we did elective surgeries, those areas suddenly became COVID areas or additional ICU units.
Wow. So in terms of what is available, you said there are beds available, but in terms of the staffing, protective gear, we hear a lot about ventilators, in hospitals, especially in New York, that are needed. Where would you say Stony Brook Southampton Hospital is in terms of what you have and what you may still need?
We have adequate PPE, and at this point, with regards to vents, we've got adequate vents as well and availability. Of course, we are doing every single thing possible in order to build our stockpile of resources. And towards the end of this week, there are many different innovative projects that are going on, and we hope to be able to announce one that we have with regards to helping us further build our isolation gowns.
So let's walk through, if someone believes that they have coronavirus, whether they've already talked to their doctor or they contact the hospital, what happens? Do they show up? Do they call first? Just walk us through that process from someone thinking they have the coronavirus, and then from that to getting to the hospital, and then I guess possibly being admitted.
Right. So it depends upon what your symptoms are. If you have mild symptoms, you should call your doctor and first converse with your physician as to whether or not you should go to the ED. However, if indeed you have a high fever and trouble breathing, then you should directly go to the nearest emergency department. If you're going to Stony Brook Southampton Hospital, you would be greeted by our outside triage area by a nurse who would give you a brief exam. Probably if you do exhibit symptoms, you would wear a mask and be escorted into the ED. And based upon that, a clinician will decide as to whether or not to administer a test, and depending upon the condition, whether or not to admit you to the hospital or whether to say that you should go home and remain isolated. So it's on a case-by-case basis.
What percentage of patients would you say are COVID related at the hospital now?
Probably about, COVID, either confirmed and or under investigation. So probably about 75%.
Okay. So now what if someone has a serious but non-COVID related issue and a medical emergency, perhaps, or episode, a heart attack, a stroke, they cut themselves terribly? How is that handled at the hospital? Are you still handling? I would think you were handling that.
Absolutely.
How does that work?
You come to the hospital, and the emergency department will immediately take you in. And as I said earlier, we do have an entire area in the hospital for non-COVID patients. And, people are still having babies. So we are 100% active in all areas with regards to emergency procedures.
But is it a separate entrance? It's a separate entrance? Is the entrance separate from?
It is through the entrance, but it's you go through the triage area, but it is indeed different when you
right. And how do you handle visitors now? Or are we not doing that, or?
No visitors, like all hospitals throughout New York State. However, as of Friday, the DOH, Department of Health, has stated that there are certain cases where a support person is permitted. And so those cases would be in the case of a delivery, maternity, you can select who that support person is. It could be your life partner, it could be your doula, whatever, but that person has to stay with you through the duration. Pediatrics, of course, and those who have disabilities and or are intellectually perhaps impaired, such as having dementia, there are allowances to have them have support as well. And of course,
Well, speaking of support, I mean, we talk every day on Facts at 5 about an act of kindness in our community, which is so strong. And this is such a trying time. And I know at Stony Brook Southampton Hospital that there have been so many acts of kindness, from people sending food to, tell me some more about them. I just know the staff is amazing. I know the frontline healthcare workers, sleepless nights. It has to be emotional, physical, a drain. Can you talk about some of the things that have gone on there that have really been, I would say, heartwarming at a very hard time?
Well, first off, our staff, our healthcare team, and the entire staff is, as I said, absolutely inspiring every single day. The way that they work and they work together. To be part of this community is so uplifting, because the entire community gets together and will do every single thing in their power to make sure that the hospital has what it needs, as well as to demonstrate their appreciation. So it's been cards, it's been drawings by children, it has been food deliveries from local restaurants and residents that have offered to purchase food. It has been the parades at 7:00 that embrace the hospital by circling around the hospital and honking horns. And they include the emergency workers and the fire department and the police department and residents as well, with children in their cars and holding up signs. And that is so uplifting to our staff. It just is, it makes them feel so that they're not alone doing this on the front lines, that this community is behind them. And there has been a tremendous outpouring of generosity with regards to donating to help us buy supplies, and also to find and locate supplies. And we do have a fund that has been set up, and that is the Health Heroes. And it is available, and you can, if you wish, to make a donation or a gift. It is on our website, which is southampton.stonybrookmedicine.edu. There's a banner, you can click on that. And to date, it's raised $1.5 million, which is absolutely extraordinary and just goes to show how
Yes.
wonderful this community is.
I get chills just hearing about all the things that people are doing. I saw the videos. We're going to try to show those on LTV of the healthcare workers being saluted, of the children's artwork. And we will put at our end credits, where you can click on for more information and to donate, and especially the Healthcare Heroes Fund, which is so needed. I know that it's been an enormous expense to mobilize for all of this. And people want to help. In terms of that, I know the summer is a big question mark for everyone out in the East End who often has their major fundraising, whether it's, the big events that you have. How are you handling that? Are events basically on pause or canceled or rescheduled? Or
Well,
I know there's the Edie barbecue, there's the main summer benefit in August.
Unfortunately, yes, that has been postponed. Edie's Backyard Barbecue, which happens every Memorial Day weekend, and is sort of the kickoff to the summer season, is sadly postponed until next year, which is unfortunate. And while it's not official as of yet, it looks at this point as if the hospital's annual summer party, which happens in August, will most likely be also postponed. However, the development team is really looking at creative ways to perhaps get engagement and create alternatives. So we'll see what we'll be doing, but it looks right now as
I think everyone has to think really outside of how this is going to go, outside the box. A couple more questions. I know you have the amazing new cancer facility, and I think a lot about people during this time who have to go through, treating cancer and having chemo, and during a time where the world is so frightening. On top of that, but it's a great resource on the East End that you have the new cancer center. Tell me how is it being utilized? I mean, people are going there. I would still think now it's still.
Yes, indeed. The Cancer Center is open and fully operational. And in fact, we are seeing many patients from Stony Brook's Cancer Center who are now being taken care of in the Phillips Family Cancer Center here in Southampton, because the Cancer Center there has been converted to help with COVID patients. So our cancer center is now operating 6 days a week.
Wow. Well, I just know that this is our closest medical facility, and it has rallied beyond belief. And every time I read something or hear something about what's happening at Stony Brook, Southampton, I'm cheered by it. And I know that at LTV we're happy to hear all these updates, and we support everything that you guys are doing. Is there anything you want to say to the local East End community on behalf of the hospital?
Yes, thank you. This being part of this community and serving this community is one of the great delights I know for everybody that I work with, and everything that this community is doing definitely bolsters the spirits of everybody working at that hospital, and they're working so hard. And together, we will come out of this. Thank you.
Thank you. And we look forward to the outreaches in East Hampton. I know that are in the works too, in terms of the hospital. So keep us posted. You're always welcome to come back, and your team. Yes, ER is very important. Thank you very much, Barbara Jo Howard,
Thank you.
Stony Brook Southampton Hospital. Thank you.